I manage a community health center in suburban Copenhagen. Last spring, this American couple walked in demanding to pay for their annual checkups. The wife had her credit card already out, waving it like she was buying concert tickets. I told them the preventive screening was covered by their temporary residence permit. She looked at her husband and said, "There's got to be a catch, right? Like they send you a massive bill later." When I explained Denmark's system just includes these services in what they already pay through taxes, she insisted on signing something. The husband pulled out his phone to Google whether Danish medical debt could follow them back to Texas. They stood there for 10 minutes trying to hand me money I legally couldn't accept. My cousin runs a pharmacy in Oslo, where an American tourist came in asking about flu shots. She mentioned the price, which translates to about $8. He stared at her like she'd quoted him 8,000. He made her repeat it 3 times, then asked if that was per dose or a monthly subscription. She explained it was 1 shot, 1 payment. He spent the next 15 minutes asking about hidden fees, processing charges, and whether his insurance would somehow penalize him for getting affordable health care abroad. He finally paid, then asked for an itemized receipt for my records when they investigate this. My friend works reception at a medical clinic in Reykjavik, where an American student came in needing her routine physical exam. She kept asking when the office would run her insurance. My friend explained 3 times that the student health program covered it completely. The American asked, "But what if something's wrong? What if you find something?" When my friend said any follow-up care would also be covered, the student got visibly emotional and said this had to be some kind of scam because nothing medical had ever been this straightforward in her entire life. This isn't about people being gullible. It's about Americans wandering into healthcare systems that actually prevent problems before they become expensive disasters, and their brains short-circuiting. So they've been conditioned to expect the opposite. I'm a health coordinator at a municipal office in Amsterdam, and this American expat showed up wanting to register for the premium preventive care plan. I told him there wasn't a premium version, just the standard national health program. He asked where he upgrades to get the executive screening package. I explained that in the Netherlands, everyone gets the same access to preventive services regardless of income. He said, "But what if I want to pay extra for better service?" I showed him the literature on our population-wide screening programs for breast cancer, cervical cancer, and colon cancer. He kept insisting there must be a VIP tier. He actually said in America, if you have money, you can get better health care. So obviously it works the same everywhere. I genuinely believed paid upgrades were a universal human right my brother manages. Patient intake at a public health clinic in Stockholm, where an American woman called asking about the wait list for her annual wellness visit. She wanted to know if she could pay to skip ahead. He told her appointments were typically available within 2 weeks. She asked what the rush fee would be to get in sooner. He explained there was no such thing. Appointments were scheduled by medical need and availability, not payment. She said, "This is Sweden. You guys are supposed to be advanced." She hung up and called back an hour later asking to speak to someone in the concierge medicine department. When my brother explained that didn't exist, she accused him of hiding premium services from foreigners. She literally said, "I know rich Swedes don't wait like everyone else." I work at a women's health center in Brussels, where an American woman came in for her HPV vaccination. After the nurse gave her the shot, she asked when the bill would arrive. The nurse said it was free under the preventive care program. The American woman said, "Nothing's free. Where's the cost hidden?" She demanded an itemized breakdown of where the money was coming from. The nurse tried explaining Belgium's social health insurance system. The woman interrupted and said, "So I'm paying for someone else's shot too? That's socialism." She then asked if she could opt out of the shared payment system and just pay directly for her own vaccine. When the nurse said that wasn't how national health care works, the woman said, "Typical Europe, forcing everyone into group plans, like she'd uncovered some conspiracy." She left convinced she'd somehow been scammed into contributing to society. I'm a public health coordinator in Oslo, and this American man contacted us asking about testosterone screening. He wanted to know the out-of-pocket cost. I told him if his doctor recommended it as preventive care, it would be covered. He said, "Covered by what?" I don't have Norwegian insurance. I explained that as a work visa holder, he was automatically enrolled in the national insurance scheme. He said, but I never signed up for anything. When I told him enrollment happens automatically through his employer registration, he accused the system of adding him without consent. He actually said, in America, you choose your own insurance. That's called freedom. He seemed personally offended that Norway prevented him from making bad healthcare decisions. My sister works at a dental clinic in Copenhagen where an American exchange student came in for her routine cleaning. After the hygienist finished, the student asked where she paid. The receptionist told her it was covered under student health services. The American said, "What about x-rays?" "Also covered." "What about the fluoride treatment?" "Covered." The student stood there cycling through every possible charge she could think of. She finally asked, "What if my teeth were actually dirty?" The receptionist stared at her. The student explained that in the US, sometimes dentists charge more if your teeth need extra work. The receptionist said they don't charge patients differently based on how much plaque they have. The student left, then came back an hour later, asking if she needed to tip anybody. When told no, she said, "Then how do they make money?" She couldn't accept that the clinic's funding didn't depend on nickel-and-diming patients. A clinic administrator in Rotterdam, where an American couple brought their toddler for a routine developmental checkup. After the pediatrician finished, the father asked about payment. I explained the child health clinic was free. He said, "Free today, but then you bill us later." I told him the Netherlands doesn't bill families for preventive pediatric care. He said, "What's the monthly premium for this program?" I explained it was funded through the general healthcare system. The mother jumped in and said, "So our taxes pay for everyone's kids?" When I confirmed that's how universal healthcare works, she said, "That seems inefficient. What if people abuse it?" I asked how someone abuses free checkups for their child's development. She said, "Well, they might come in too often." She genuinely thought parents would waste their own time bringing kids to unnecessary appointments. Just because it was free. My cousin works at a pharmacy in Lisbon where an American woman was picking up her birth control prescription. She asked what her copay was. The pharmacist said contraception was free under preventive healthcare services. The woman said, "Free? Are you serious?" The pharmacist confirmed. The woman asked if there was a cheaper generic version she should take instead. The pharmacist explained that when medication is already free, there's no cheaper version to switch to. The woman seemed personally insulted by this. She said, "This doesn't make economic sense. Someone's paying for it." The pharmacist agreed that yes, society collectively pays for preventive care through taxes. The woman said, "That's not sustainable." Like she'd discovered a fatal flaw in Portugal's healthcare system that none of the Portuguese people had noticed. She took her free birth control while muttering about fiscal responsibility. I manage a community clinic in Vienna where an American man scheduled his first preventive health screening. He brought a folder full of documents, his insurance card from the US, and a printed list of questions about billing. Before the exam started, he asked if we needed a deposit. I said no. He asked if we needed his insurance information. I told him it was already in the system through his work permit. He asked about the deductible. I explained Austria doesn't use deductibles for most healthcare services. He asked what his maximum out-of-pocket would be. I said the screening was covered entirely. He looked genuinely stressed and said, "There has to be something I pay for." When I told him he could go ahead with the full exam without worrying about costs, he said, "This feels illegal." He literally couldn't proceed with medical care because he couldn't figure out what financial trap he was walking into. He kept saying, "In America, they always get you somehow." I'm a medical interpreter at a hospital in Zurich where an American patient needed a follow-up screening after a routine mammogram showed something unclear. She kept asking about pre-authorization. The scheduler told her the follow-up was already approved. The American said, "But who approved it?" The scheduler explained the radiologist's recommendation automatically qualified her for additional imaging. She asked, "Don't I need my insurance to approve it first?" The scheduler said Swiss healthcare doesn't work that way. If the doctor says you need it, you get it. The woman started crying. She said she'd spent 3 months in the US waiting for insurance approval for this exact situation, arguing with representatives, getting denials and appeals. She couldn't believe she could just schedule the appointment and show up. She kept saying, "You're telling me I just come in?" Like it was too simple to be real. My brother works at a health center in Nagoya where American teachers are offered free annual health screenings through their employer. Every year, at least one American refuses to participate, so they're convinced it's a scheme to collect medical data for higher insurance premiums. One teacher said if they find something wrong, my rates will skyrocket. My brother explained that Japan's national health insurance doesn't raise rates based on screening results. Everyone pays the same percentage of their income. The teacher said, "That's what they tell you now." He tried to convince my brother that Japanese insurance companies were secretly selling health data too. American insurers who would flag him when he moved back. He said, "I'm not falling for the preventive care trap," and insisted on signing a waiver. My brother had to explain several times that refusing basic health screenings wasn't legally possible under Japanese employment law. The teacher left saying, "This is exactly why I don't trust socialized medicine." I worked the front desk at a screening center in Helsinki, where an American graduate student showed up for her free cervical cancer screening. She asked if she could pay cash instead of using her student health coverage. I asked why. She said, "I don't want this on my permanent record." I told her preventive screenings don't go on any record that affects her negatively. She said, "In the US, insurance companies can see everything and use it against you." I explained that Finland's system doesn't work like that. Healthcare is a public service, not a business trying to deny coverage. She said, "You say that now, but what happens when I apply for private insurance back home?" I told her American insurance companies don't have access to Finnish medical records. She didn't believe me. She said everything's connected now. They'll find out. She left without getting screened, convinced she was protecting herself from future insurance. Discrimination. My sister coordinates health services at a language school in Barcelona where American students get free preventive care through their enrollment. An American student called asking about vaccines she needed for travel. My sister told her the vaccines were covered. The student asked, "Even though I'm not Spanish?" My sister confirmed that students have the same access as residents. The student said that doesn't seem fair to Spanish people. My sister asked what she meant. The student explained that, in America, taxpayers get mad when services go to non-citizens, so she assumed Spanish people must resent foreign students using their healthcare system. My sister told her Spain views healthcare as a human right, not a limited resource to fight over. The student said, "But someone's losing money on me." She couldn't comprehend a system designed for universal access rather than profit. She actually said, "This is why European healthcare is going broke," citing something she'd read on a blog. She took her free vaccines while apologizing to my sister for bankrupting Spain. I work at a health policy institute in Geneva where we hosted American healthcare administrators studying European systems. During a presentation on preventive care access, one administrator interrupted to ask, "But how do you prevent people from overusing services?" Our director said that wasn't a concern because preventive care reduces costs long term. The American said, "Right, but what about personal responsibility?" The director asked what he meant. He said, "If healthcare is free, people don't value it, so they waste it." Our director asked how someone wastes a cancer screening that might save their life. The administrator said, "They might get too many." When asked to clarify what too many cancer screenings meant, he couldn't answer but remained convinced that free access created moral hazard. He left saying European healthcare was unsustainable. Despite our lower costs and better outcomes, the weirdest part isn't the confusion about how preventive care works. It's watching Americans realize it works better than what they have, then immediately inventing reasons why it shouldn't. They'll stand there receiving excellent affordable care while explaining why it's actually bad. Because accepting the alternative means confronting what they've been missing their whole lives.